Hi, my name is Dr. Andy Mellis and I'm a GP here in Toowoomba, and today we're talking about how we can approach dealing with difficult relatives in relation to aged care. This sort of situation can arise for a number of reasons, and often it can be around concerns relatives have at the level of care their aging relative is receiving, and they often just genuinely want to try and do the best for their elderly relative, and sometimes that can be difficult to manage as a GP. I think, as always when dealing with people, it's important to acknowledge their concerns, to give them time to express the anxieties or the frustrations that they have, and to explore with them how those situations arose. I think, as with any general communication strategy, it's so important that people feel that you gave them time to talk and that you listened. And if you can do that, I think any of those situations will become easier to manage for you. Once you've got a level of rapport and relationship with those relatives, you can try and move forward with that discussion to try and get some actual facts about what are their concerns, where have they arisen from, and try and get to a point where you can come up with a list of actions in terms of what are the specific areas that they as relatives would like to see resolved, and what would to them get them to a point of feeling like progress had been made. They may not be areas that you can resolve straight away, but I think if you have a clear list of targets and strategies that you're working towards, then the relatives will often feel like they are getting some action towards the end point that they wish to reach. Having said all that, of course, it's important to ensure that you don't overstep the mark in what you can promise them, and they do need to have some realistic expectations about what can be achieved in what are usually elderly patients with multi-system diseases, and there's a level of education required for relatives often, because we will often find that they can have unrealistic expectations about what you'll be able to achieve, particularly in a nursing home environment. And so retaining that honesty whilst combining that with a willingness to work towards shared goals is always important. Once you get to a point in those discussions with the relatives where you feel that you've got an agreed path of action and some areas that you're prioritising to work on, I think it's always important to ensure that they leave that discussion knowing that you have an open door to them, that you have a willingness to reassess the progress at a point in time in the future, and that you are very happy for them to come back to you if they have further concerns. Again, that just comes back to if they feel like you've listened and taken them seriously, that's often the biggest solution to any problems that you'll face.